welcome to today's episode of Health University. I'm Dr. Susan Fox, and today I have the good fortune of talking with Dr. Chiruba Prabhakar. Am I pronouncing that correctly?
Yes.
All of a sudden I realized, oh goodness, I wasn't sure if I had the correct pronunciation. So Dr. Prabhakar is a board certified OBGYN and a fellowship trained, this is important, minimally invasive surgeon specializing in the latest surgical treatments for gynecologic conditions. Her specialty includes fertility sparing fibroid surgery and endometrial polyp surgery and removal. So if there's anything that I've missed about your bio, please elaborate on anything that you would like the listening audience to know about you, because truly minimally invasive should be air quotes, highlighted, asterisk. That's so important for fertility.
Yes. So first of all, thank you so much for having me
Pleasure.
on this podcast, and really excited to be here and talk to your audience. So as you mentioned, I am a board certified OBGYN. And then as I finished my training, as we're coming towards the end of it, there were a lot of latest new surgical techniques being developed, especially the robotic platform. So robotic surgery was a big thing in the early 2000s, where we could make very tiny incisions on patients' bodies and take out these big fibroids, or do this complex surgery, or even remove a uterus, for example. I decided to get a little bit of extra training in that. And so I spent 2 extra years in New York learning.
Just a little extra.
Yes, I know. In the grand scheme of things, I've lost track of how many years I've spent training.
Yes.
But this was really an amazing opportunity to learn these latest techniques. And now in my practice, when patients have fibroids or ovarian cysts or endometriosis, and specifically patients who are looking to get pregnant and who are in that fertility journey undergoing IVF, we really want to preserve the architecture of the uterus. We really want to do as little damage as possible while still treating what we need to do. And so that's where I love using the robotic platform. And I do a lot of that surgery for my patients who are trying to conceive. So that's a little bit about, what I do.
That's fantastic. And then do you have a surgery center like in office? Does it need to go to hospital?
Yeah, that's a good question. So we do a lot of procedures in the office, like smaller procedures, biopsies, colposcopies, things for abnormal pap tests. But when it comes to the larger surgeries, they do require general anesthesia, so they are done in a hospital setting.
That's what I thought, but I didn't know, and I thought, well, if I'm thinking incorrectly, and there is a possibility of just doing it in office, that would be sort of an added benefit.
Yes.
So Dr. Prabhakar is in Lafayette, California. And so if anybody in the listening audience is in California or wants to travel to California, here again, the idea of doing a surgery procedure that, if as necessary, is minimally invasive is really crucial to considering preserving one's fertility. And then I guess I would ask, what do you find in your practice, Dr. Prabhakar, is sort of the primary issue for women of reproductive age?
Yes, this is something I've become really passionate about, talking about, is that many young women are not aware of the pitfalls or the roadblocks that could potentially be presenting on this road to fertility. So they go along, they don't have any symptoms, they don't have any pain, and boom, it's time to then have a baby. And then they find out, oh no, I have fibroids, or oh, actually, I have endometriosis and I can't get pregnant as easily as I had anticipated or thought. And so my biggest message to young women is to really make sure you're seeing a gynecologist every year, because we can pick up things that you can't. And especially when things are slow growing in your body, you get used to it and you don't realize, oh, I actually have a big mass in my pelvis. But when I do an exam, I can very quickly pick that up. And so having that relationship with a gynecologist is very, very important. And then when you're really trying to think about getting pregnant, talking about your history, perhaps getting a pelvic ultrasound, or other crucial things that I recommend to patients.
Yes, I agree. We're hearing a lot more in the field about silent endo, which is just crushing for a person who has, I'm going to use the pronoun her, in her life, where she's wanting to conceive and had no idea because she didn't have the classic symptoms, but she has the inflammatory condition that is consequent to endometriosis. Do you see a lot of that in your practice as well?
Yes, I do.
Mhm.
I do see that. Sometimes when I go in to remove a fibroid, I'll actually see stage 3 endometriosis, and I'll tell
Wow.
the patient, "Did you know that you had endo? Did you have pain? The classic symptoms of painful sex, painful bowel movements, painful periods." And she'll say, "No, I just had the heavy bleeding, so that's what made me, come in for the fibroid surgery. But
Mhm.
no, I did not know I had endo." But we know
Mhm.
that endometriosis also inhibits fertility. And so it's really important but when you have that relationship with a gynecologist, it's easier to get these things sorted out and figured out and moving on versus, as we know in our typical healthcare system these days, it takes 3 months to get an appointment and then another
Mhm.
2 months to get all the workup and then another
Mhm.
3 months to schedule the surgery. And time is flying. And I think for many people, we've spent our entire 20s doing birth control and doing all these things to not get pregnant. And then when we finally try to get pregnant, it's not
Mhm.
that easy.
Absolutely, absolutely. And certainly I am a proponent of contraception as one needs it, but being on contraception does not mean don't see your gynecologist, because that's where you can be missing something that is key. And if there is a thought that you might want to have children one day, and frankly, even if you don't want to have children one day, you want a healthy reproductive system. So
Yes.
don't miss that annual gynecologic visit so you can just stay up on what's going on, what's up down there, as they say.
Yes, exactly. And I would also
Mm,
stress that it's important to see a gynecologist versus just a family practice doctor or an internal
absolutely.
medicine doctor. And they may be drawing your labs, checking for cholesterol, and doing all of those things. But, as GYNs, we do pelvic exams. I don't even know how many thousands I've done, right? So
Right.
we can pick these nuances a lot more quickly. And so
Yeah.
I think it's really important to actually also have a gynecologist.
Yeah, the likelihood that you're going to see markers for fibroid or endo or any of these potential structural impediments to fertility on lab work is slim to nil. So you need the
Exactly.
physical exam, just for your whole health as well. I mean, cellular changes can take place at the level of the cervix. That's why you want your PEP as well, to make sure that viruses can take place. That's the nature of being human. We become hosts to viruses, including the herpes virus. Speaking of herpes virus, and I heard you say colposcopy. Do you see that as being an impediment to a fertility journey as well?
Well, we know that HPV and human papillomavirus is one of the biggest cause of cervical cancer. But
Mhm.
the good news is that that's very slow growing.
Mhm.
So it's not so much that somebody has a positive HPV test and that's going to be an impediment, but there's a lot of stress and anxiety that goes along with having a diagnosis of HPV. And that's
So
what I
true.
see
So
in the
true.
office. Women are freaking out because, oh my goodness, how did I get this? And what's going to happen? And what do I need to do? And we know that the immune system is weakened in pregnancy. And so HPV can progress, the lesions can progress a little bit faster. And so there's that anxiety. And again, if you have a relationship with a gynecologist, getting that colposcopy, doing that biopsy, doing whatever you need to before you
Mhm.
even get pregnant will put you at peace of mind.
Absolutely. And you'll be better
And
prepared if you need any kind of intervention. You're not then trying to chase
a,
a sign or a symptom.
exactly.
And I just
And
want to sort of amplify the statement you just made in terms of the unnecessary shame that women go through when they get a positive HPV. We don't feel the same way if all of a sudden we get a cold sore on our
right.
lip. It's the same virus,
Yes.
similar virus, same family of
Yes.
virus. And so there is no shame in virus. We are hosts to virus. We catch a cold. We had COVID going around. There are viruses proliferating all the time. So please, please, please don't let, the concern of HPV virus be one that keeps you from seeing your gyne or keeps you from having an annual exam. Would you agree?
Yeah, yeah, 100%. I mean, we see that all the time. And I tell women, 70% of American women have HPV. So
Mm-hmm.
this is the most common STD in the United States. We talk about gonorrhea, we talk about chlamydia, we talk about HIV prevention and all these things. But really, in clinical practice, day in and day out, I see HPV. And
Mm-hmm.
so this is a very common virus. But yet, when you first get the diagnosis, it's a little shocking.
It puts you
And
on your
as soon
heels.
as
Yeah.
yeah,
Mm-hmm.
and as soon as it's linked to cervical cancer,
Mm-hmm.
when we think about cancer, we think about fast growing, oh no, overnight. But cervical cancer is extremely slow growing. But at the same time, you do want to have the adequate steps before you get pregnant and a plan for after you get pregnant, after you give birth rather, to act on those results and, prevent any progression of the disease.
And then over on my side, on the holistic side, it's let's do everything we can to bolster your immune system so that your own immune system, blood cells can mitigate and kind of keep at bay any proliferation of HPV.
Yes, we know that acupuncture, stress relief, antioxidants, all of these things help with HPV regression, or just, as you said, keeping it at bay. So that's a holistic approach is always recommended.
I would say an integrative approach, right? It's not one or the other. Please, please, listening audience, do not think it's one or the other. It is both and, in order to have yourself really covered and protected and supported through fertility, through pregnancy. So I inferred that, you speak to the 20-something, person who is more likely to be interested in contraception than in conception and fertility. However, what I think I heard and what I want to amplify again is get your baselines, get your health screening in your younger years when you think, I don't want to have a baby now, but I might want to have one someday. Or, as I say, I don't want to have a baby ever, but I want to have healthy hormonal system and reproductive system. So please, 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 listeners, don't wait the 4 years or 6 years until you're out of college and in your position and insurance will cover it. These are procedures that are typically covered in some form. So don't wait. That's the key takeaway. Thank you for sharing in our conversation here at Health University. One of the ways in which we help people improve their fertility is through our 5-element fertility quiz. Please click on the link below at yourfertilityquiz.com and take this short quiz. You'll receive a free report that includes easy to implement ideas to improve your whole health and your fertile health. Now let's return to our topic in today's episode. I have a couple of questions here that I wanted to ask in terms of if someone, well, first of all, what would be, you mentioned a couple, a sign of endometriosis or a fibroid that somebody might want to say, oh, that happens to me during my cycle.
Yeah. So the period, I tell everyone, is like a vital sign. It's like your blood pressure and your heart rate. So if you are getting your period regularly, every 24 to 35 days, whatever your cycle is, and if it's a regular flow, 3 to 5 days, and you're still able to continue doing your daily activities, that's, you're in a good space. But if your periods start to become extremely heavy, where you're changing a pad every hour, that's not normal. And so if it's really heavy or it's really, really painful to the point where you're calling out of school, calling out of work, having to lay in a fetal position in your bed, that is not normal. If you're having extremely painful bowel movements, especially during your period, or painful intercourse before and after your period, these are also signs that something may not quite be right and may need to be investigated. Again, when it comes to periods, very few people talk about it. So a lot of people are suffering in silence. And when I see them, when they're 30, they're like, oh my goodness, I didn't know that this was not normal. I always just called out of school for, those first 2 days. But that is not normal. Of course, everybody has little cramps. You may take a Motrin, a Tylenol here and there. But if you are having any of these symptoms to the point where you are having to forgo your social activities and your day-to-day activities, that is not normal.
That is a red flag, pun intended, with the color red. And then there was a thought that came in and went out of my mind as quickly as just that. It had something to do with the fact that when someone is having sort of, painful sex, painful bowel movement, that would be, I imagine, a sign of endo is what you're thinking, as opposed to fibroid.
Yes,
and if someone's having excessive bleeding, is that more a sign of fibroid?
More a sign of fibroids, but a lot of times these conditions coexist as well. So when we get in there, put a laparoscope in and take a look, often we see a little bit of both in patients who are having all of these symptoms. And we also want to take into account, okay, if we have this diagnosis, okay, how are we going to treat it medically, surgically, recovery, all of this. And before you know it, the months are running by. So this is another reason to really plan this out rather than when you're 40, being like, oh my goodness, I need to do all these things.
Right. I know that endometriosis is a progressive condition. I don't like to use the term disease because that sounds fatal, but it's a progressive condition. So getting on it sooner rather than later can keep it minimized or perhaps even cleared. Would you agree?
Yes, clearing it and then also helping just manage the symptoms and preventing recurrence
Mm.
is important. So these are all strategies that your gynecologist can help you with. And the other thing is there's constantly new innovations in this field. I mean, just the last 10 years that I've been in practice, I mean, every couple of years there are new medications, there are new techniques of doing things. And so this is another reason to keep seeing your gynecologist because new treatments are on the horizon,
Mm-hmm.
which is
Mm-hmm.
exciting.
Absolutely. Are you thinking Lupron perhaps? Is that what you're thinking? Is like
Well,
a
Lupron is actually one of the more old,
right.
the
It's
older
been around for
medications,
a
but
bit. Mm-hmm.
yeah, but now we have things like Myfembry or
Mm-hmm.
Lissa. And in terms of even procedures, before it used to be kind of hysterectomy, myomectomy. Now
Mm-hmm.
we have uterine embolization. We have Acessa, which is just embolizing the fibroid itself, or through radio frequency ablation, I should say. So there's new techniques that we are constantly coming up with and learning and doing with good fertility data as well. And
Mm-hmm.
so that's another reason to keep on that journey, especially when you think you have that diagnosis.
Mm-hmm. So here's a question that I imagine the listening audience would have. What's the difference between a fibroid and endometriosis?
So a fibroid is actually a tumor of the smooth muscle in the uterus. So a fibroid grows on the uterus, inside the uterus, in the wall of the uterus. It's connected to the uterus. It's the same tissue. But because it distorts the cavity of the uterus, it causes heavy bleeding. Endometriosis is completely different. This is where the glands of the uterine lining escape the uterus and start to implant in other areas like the bowel or the ovaries or even the rectum, which is why some people have painful bowel movements, or
Mm-hmm.
the pelvic cavity. So it kind of escapes and goes elsewhere. And so when you cycle every month, it's just not the glands in your uterus that are cramping, it's all these other implants cramping from everywhere else. And so this
Mm-hmm.
is what causes that pain.
Yeah, cramping from muscular tissue that has the nerve endings to
Yes.
indicate pain. Yes.
Yes.
Okay. Thank you for
Hmm.
that. I appreciate that because here again, I've had that question asked of me in practice. And so I know that it was not just this one, two, or three people who had the question, because I think there can be an impression that that endometriosis is a fibroid outside of the uterus, but they are different
Completely
tissue
different. Completely different tissue.
altogether.
Yes.
Mm-hmm,
Yes.
mm-hmm.
Yeah.
Okay, great. Thank you. Okay. And then in your experience or in your observation, what is the most common cause of endometriosis? I mean, I have my ideas as to, why this is happening in a younger person's body who's, early in menstruation, but I'd love to hear yours as well clinically.
Yeah, so that is $1 million question. I
Yes,
wish
I
we
know.
knew, right? There is a genetic component to endometriosis. 10 to 20% of patients with endometriosis have a mom or a sister or an aunt with endometriosis. But sometimes it's very hard to explain. I had a 10-year-old with endometriosis,
Mm,
boom, the moment she got her period, within a few months, we had diagnosed her and it was biopsy proven endometriosis. And I also think that our nutrition has a big role to play. Certainly, environmental toxins and pollutants such as the BPA in plastics that are everywhere, even if not in our water bottles and just our environment in general. I would say, in terms of managing and reducing symptoms long term, nutrition is queen. Nutrition
uh-huh.
is huge. And this is something I talk with my patients about all the time. Even genetically, if you were dealt that card, there's
Mhm.
still a lot you can do with nutrition, movement, stress relief, sleep, all of these,
Sleep, yes.
yeah, all of these other pillars of health that you
Mhm.
can bolster to help with endometriosis. But we are yet to find a specific gene that causes it, or a specific way to predict who is going to get it, because
Mhm.
sometimes it pops up when you in your 30s, you were doing
Mhm.
fine when you were a teen, in your 20s, and right at that reproductive age, it comes up.
It's not
um,
necessarily that you were playing field hockey and wearing a tampon and running around the field. That might have been exacerbating or something, but that didn't cause your
right.
endometriosis. That's what I really want. And I hear that a lot. It's like, oh, it's because I wore tampons in high school while I played my,
Oh,
physical sports.
no. No, no,
Mm-hmm.
no. Yeah, there's nothing that you did to cause endometriosis, but like a lot of medical conditions, there is a lot that we can do in our power to help mitigate the symptoms or help ourselves feel better,
Mm-hmm.
even if we have that diagnosis.
Because
Yeah.
as we keep ourselves more anti-inflammatory diet, antioxidant
Yep.
supplements, all of these things will keep that endometrium where it belongs. It's not going to be inflamed and then retrograding out. Am I correct?
Yeah, exactly. Even if it is, we prevent the stimulation of it by reducing the estrogenic influences on our body, mainly with food. And so I really advocate more of a plant-based, now that you can't eat meat, but more of a plant-based diet and also movement. We know that exercise and moving really
Circulation.
helps. Circulation and sleep. I think that's very underrated, but sleep really also helps with immune function.
Without a doubt. Well, I
Yeah.
want to be respectful of your time. I know that you've got a patient coming, and I hope I get to have you back at another time. But before
Yes.
we wrap up, are there any pearls or tidbits or recommendations you'd like to give the listening audience so that they can walk away with action steps?
Yes, so this may seem really basic, but I think I can't stress it enough. Number one, make sure you have a gynecologist who you have a relationship with, not just a primary care doctor, but if you are a person with a uterus and ovaries and a reproductive system, definitely make sure you have a gynecologist that you're seeing regularly. And the recommendation is every year, starting at about age 15 to 16. So that's number one. And then number two, do not underestimate the power of nutrition and movement. It seems like that is just overstated, but it can't be stated enough, in my opinion.
I couldn't agree more because
Yeah.
it may be overstated, but all we have to do is imagine these 20-year-olds in front of the laptop or on their phones, hunched over in this contracted position, eating, chips and pizza or whatever. All of those things are additive to the inflammatory condition.
Yes, and the last thing I'll say is it's never too early to work on your health. I know when I was in my teens and 20s, I remember going to my physical probably when I was like 17 or 18, and my doctor asked me, "Well, do you exercise?" And I said, "No." And I always was kind of like offended that he asked me that. I was like, "I'm 18, like why would I exercise?" I still remember that.
That's
And then as I
funny.
was going through college and everything, and here I am in the pre-medical tract, and I know something about nutrition, but I always thought, well, that's for when I get older. And now I think back to all of those opportunities that I had to cement those habits early on,
Right.
so that it would just be second nature to me now. So if for those listening, if you have kids, I'm telling my 7-year-old, my 9-year-old right now about how to eat well and how to move so that they can really get these habits downloaded in their minds. And so it's never too early to start working on your health,
I
and never too
couldn't.
late
Yeah,
either. Yeah.
perfect. Thank you. Yes. But as you say, it's the habit forming. It is that as we do this time and again, we become identified with, I am a person who eats well. I am a person who exercises regularly. I am a person who cares about my sleep habits. And when we identify with it, we want to perpetuate it. And as we
Yes.
perpetuate it, we get better and better and better.
Yes. Yes.
Well, Dr. Prabhakar, I'm going to leave in the show notes your contact information and how someone can get in touch with you. Do you have an open practice? Can people reach out to you?
Yes, so I have a private practice in Lafayette. It is founded and run by me, and I'm the only doctor here at the moment. We provide boutique gynecologic care for women through all phases of life. As I mentioned, my youngest patient is 10 and my oldest is 87. So
Wow.
from annual exams, first teen exams, fibroids, ovarian cysts, pelvic pain, to menopause and sexual medicine. I sort of do it all. And so we are definitely taking patients. You can also follow me on social media at the Fibroid Doc. I don't just talk about fibroids, but I do talk about all GYN health. And lastly, you can also subscribe to my newsletter from my website. And I send out a newsletter every 2 weeks with free webinars, free resources, and the information out there.
Beautiful. I'll be sure to have all of that in the show notes as well, so that people don't miss an opportunity to connect with you. And here's an unusual question, but it happens in my practice. If someone were out of state, could they fly in or, kind of come into state to see you and establish a patient relationship? Or is that just, and then, go back to East Coast or whatever, and then be able to do video consult for a bit? And the reason I ask this is that if someone is recently diagnosed and is on the track and, struggling and wants to get pregnant soon, that person listening might be saying, oh gosh, this is the doctor I need. So
Yeah,
is that
that's a really good
available?
question. So I have two options. One is to establish as a patient, if you're in California, so if you want to fly in, that's totally fine. I do have patients doing that. Or if you go back, I also have a coaching program where it's very
Mm.
similar to a consult,
Hmm.
but I just don't put you in my medical record as a patient, but you're still talking to me. We're still talking about all the things, but it's just structured a little bit differently to protect, my license in California. So
I do the
wherever you
same,
are.
and I
Yes,
completely understand. That's why I highlighted the flying in. If you want,
yes,
if you
yes,
want medical coverage, licensed coverage,
exactly.
as you say, there's lots that can be covered in a coaching
Yes,
platform that does not
yes,
require a physical presence. So
yes,
that is
yes.
wonderful. And again, I said I was going to be respectful of your time 5 minutes ago,
Okay.
and I
Oh,
went on
no,
a
no,
little bit
no, this is
more.
great.
But thank you, thank you, thank you. And I hope to have you back one day
Yes,
soon, because I know
yes.
that we could just take a deep dive in every single one of these,
Hmm.
diagnoses, and give the listeners a whole lot more for action items to work with. So we'll
Yeah.
schedule and we'll get you back on.
All right. Well, thank you so much for having me. I so
My
appreciate it.
pleasure. My pleasure. And listeners, as we say at the end of each of our episodes, class dismissed at Health University.
All right.